Hey, this is a brief video of beware of computer-simulated cosmetic surgery results in the absence of examples of patients that have been done. And what brings this up is we had two guys recently, one guy that had been done twice by a practice that does a lot of advertising, and he'd had an FUE that didn't work the first time, and then they went back and did a strip on him, and he had limited growth on that, and he made several comments that I thought were alarming. One is that he never saw the doctor. At least in the state of Virginia, that is a big problem. Thing number two is he said that the techs looked real different, and they were all real young, and although we have younger techs, they look the same from year to year. You got to have techs that are trained. And then the third thing that I thought was most troubling was that he said, but they did this computer imaging, which we do not have. I do have it for noses, because I think it's important to plan noses that way. But they did computer imaging of what he'd look like if he had a hair transplant. And it didn't turn out that way. And I said, did you see any patients that they'd done? Did you see any videos, any posts online? And so you can simulate anything virtually with the computer software. It's a modification of Photoshop. And I can simulate a rhinoplasty that looks undoable or perfect, and then can you achieve that? Well, you probably can't achieve the undoable ones. And similarly with hair transplant simulation, the software doesn't take into account the competence of the cutters, placers, doctor, planner, nor the thickness and density of the donor area. So be cautious on that, don't you think, Wendy? I mean, that's just really frustrating.
Yeah. I said, so what made? I asked him. I said, I was like, so. I mean, he looked like a smart guy.
He's a smart kid.
Yes, and he was asking the right questions, and I was listening. I said, so what made you go to that? Like, what got you excited of doing it? Did you see a patient? Did you? Oh no, it was the computer image that he saw how he was going to turn out that he liked.
Right, and just to let you know that anybody can be sold that kind of stuff. Me, for example, I exercise a fair amount, but as a 53-year-old guy, I've got a little bit of extra tissue there on my love handles, and so I numbed myself up and liposuctioned it out a couple of years ago, and there's still just a little bit there. And so Wendy and one of our doctor patients have this cool sculpting machine which melts away some fat, and so 2 days ago I said to Wendy, let's get that last little bit of fat. And if I were a less knowledgeable person and Wendy was a little less scrupulous, she could have showed me a picture of some dude with a sculpted set of abs and said, oh yeah, lay down here for an hour and you'll look like this in 2 months.
Yeah, and I could have. I think, if I
was ready.
You were ready? Yeah, I took pictures, but then I touched your love handles. There's no fat in there.
It's just
a
getting
little
old.
bit of excess skin.
Yeah. So you guys and girls who think computer imaging is the thing that sells you on a procedure, it's not a bad tool to use as an educational or planning instrument, but make sure you see examples of patients that the doctor you're choosing has done, whether it's in person, in a picture book, online, videos, whatnot. Right?
Yes.
If we can help you, please give us a call. Thanks.